her PowerPoint up. And I will turn it over to Rachel Hatton-Moore from South Carolina to share more about First Five South Carolina.
Sure. So thank you all so much for having me. I'm really excited to talk to you all today. So there looks like there's about 16 of us in the room and a couple more joining. So I appreciate y'all coming to join me here in room 4. So far, we've heard a lot about different types of systems and different types of efforts. And I want to talk to you about First Five and how we pulled together a lot of these efforts and sort of built one beautiful thing. So before I roll into that, I want you all just to take a second to do something a little weird. And so that is to just like close your eyes, don't fall asleep on me, close your eyes and think of your favorite website. Can anybody think of does anybody have a favorite website anymore? I don't know, but think of it and then think about that as we move through First Five and what kind of things you look for when you're on websites and what kind of things are useful to you and visually appealing. And we'll talk about that, and we'll also talk about a lot of other things. So I hope you'll get something out of today. And then I know we have time for questions at the end, but I'm also really casual. And so I'm totally fine with you jumping in sometimes as I move through things. So that way we can make sure everybody gets things covered. All right. So many of you may not have maps of flows of funding in your state, but this is South Carolina's flow of funding of state and federal funds into our public early childhood system. And so you'll see here that we have a mixed delivery system, and this we've actually prettified this some, so it's a lot neater than it used to be, but it's still a little difficult to see. And there's lots of different programs, lots of different agencies. And so if it's hard for us as system leaders and for those of us who have been direct service providers to navigate the early childhood system, we know that it's also very complex for families across mixed delivery systems. And so at the Early Childhood Advisory Council, where I'm the 2-generation coordinator and the project manager for First Five, which is housed at First Steps, we represent all of these agencies sort of here in teal in the middle. And so First Five brings together the ECAC agencies and then also additional key partners in public early childhood education and outreach. So where did we start? One of the things I wanted to make sure I talked about today was the background of our project and any challenges we faced and sort of what our timeline has been, since I know that those are things that other states tend to be really interested in. So if you look at when we first started our thinking about First Five and what it might possibly be, we used the funding from our PDG planning year to have sort of a 1-year study to look at would this be feasible? And it was based on feedback that we had gotten from the PDG needs assessment about what were families needing. And some of the top things we heard from that, that needs assessment, from the listening sessions that we did and from the surveys, was that parents wanted to know what was available to them, and parents wanted to know how to access those things, and they wanted more time. Now, I know all of us wish that we could just make some more time in our days. So what we decided to do and looked and investigated if it would be possible was ways that we could streamline services. Or streamline information so that we could make access a little easier, thereby saving time and creating some efficiencies for system leaders and navigators as well. When we talked earlier about engaging families and lived experiences, South Carolina also has a Family Voice Council, and that is also a PDG funded initiative. We have 20 parents of children ages birth through 5 from across South Carolina who have participated in publicly funded programs and services. And we meet each month and provide feedback to service leaders and have feedback loops about quality improvement efforts. And so these are some of the feedback that we got from our Family Voice Council members about how laborious it is to fill out lots of applications. And we know that because we go to doctors, right? And so we have to fill out the same information each time, even though I just went last month and gave you my insurance card then too, you know? So imagine doing that. And some of you don't have to imagine because you're parents. So doing different registrations at every school, or putting in your household information 4 different times across 4 different applications. And so we gave a lot of thought to how to address some of these things that parents were bringing up to us. And we did that with the feedback of parents along the way through listening sessions and test groups, and also community stakeholder meetings to provide feedback about the different development processes and development, like where we were with our development before we launched the different phases. So in South Carolina, and probably in your states too, we want all children and families to be successful, happy, and flourish. And we embrace the 2-gen approach in South Carolina. And so we consider a 2-gen effort because it helps connect families with a variety of resources available to them. And so we took those 60 programs that that were represented on the flow of funding, and then we broke them into 5 simple categories because we also know that families don't often care if a program is offered by one agency or another. And we as system leaders know that sometimes a program is funded by one agency but delivered by another. And so it gets really complicated. And so we focused on the programs, and then each program has a page so families can learn more about it. And then they can also check eligibility for 40 of those that have criteria. And I'll show you a quick demo in just a few moments. So First 5 is optimized for mobile devices because I want to know how many of you use your web browsers on your computers to buy things from Amazon, or do you go to it on your phone? What we found is that about 90% of users of First 5 are coming from mobile devices. And before we move much more forward, I want to talk about another 2 efforts in South Carolina, and we will get to another of those later. But one of those is First Steps 4K Plus, which is also a type of coordinated eligibility, and that is a partnership with First Steps 4K and childcare vouchers. And when we get to, I just want you to keep that in your mind, because when we get to the application, you'll see it and I'll talk about it again. And then I also wanted to tell you about how we knew that we needed to make sure we optimized for mobile devices. So during that PDG planning year where we were doing sort of our landscape analysis and gap analysis to see if First 5 was needed, we also worked to build a similar portal that is part of our system in South Carolina, and it's called Palmetto Pre-K because South Carolina is the Palmetto state. And it brought together 4 agencies, DSS for childcare scholarships, Head Start, the Department of Education for their public 4K, and First Steps 4K. And families can complete an eligibility screener there to see if they're eligible. And then if there's an online application that any of those 4 agencies offer, they can navigate to that application online or have all the contact information for the provider to get there. That was the test case for First 5. And we realized that to support the whole family and the whole child needs, there were things beyond early education. And so that's when we looked at health and nutrition and those other 4 categories. So we are now working on connecting Palmetto Pre-K and First 5 as the larger responsibilities of the early childhood system for portals and greater access. So when you go to First Five, this is the first screen that you'll see, and it is front and center to check your eligibility. Now you can go to services and learn about each of them and navigate to those independently. You could go to Who We Are and learn more about First Five's history. You can go to the Learn tab and find articles and resources that are updated quarterly. With more like blog posts that are from partners and content that's relevant to families. And we also try to tie that back to the top search terms that are bringing families to First Five. And then there's also stories. So families can share how the early childhood system has impacted them and, ways that we can better support families and how useful some of these programs and services have been. And then we also work with our navigation partners who are system navigators for families who feel like they may need more assistance. First Five was built on the principle of self-navigation and families having ease of access and the lowest barriers to receiving information. But we also know that some families might get to the First Five and feel a little overwhelmed or still have questions or might have special circumstances beyond what is answered on First Five. And so we want to make sure that they can get connected with our partners who can provide that additional support to them. So once you click on that button for check your eligibility, this is the first screen you'll see. So it'll take you across 5 simple screens. The first one collects your contact information, and we're going to be pretending that we're Pamela Cooper, who is a parent of a young child in Lexington County, which is right outside of our capital and has a lot of different resources available to families. And so Pamela gives her consent to share her information with partners. So we do have partners who can retrieve only her contact information and an aggregation of what programs she may be eligible for so that they can call her or email her with information about how to enroll. And that is a different level than what we'll get to on the application. So this is her child's date of birth. And notice at this stage, we don't collect child's name or anything like that. At the address level, you'll see that she lives in Lexington, South Carolina. And the reason that we geolocate this way is because in our system, we have a different array of providers in each area. So one county in our coastal region may offer a different array of programs than someone in our Piedmont region. And so we want to make sure that no matter where in the state someone is, they're able to see only the programs that are available to them. So they're aware of what those resources are. And this screen is kind of long, but as you can imagine, with over 40 programs, what we've done here is look at the individual criteria for each program, and I mapped it with a really clunky Excel sheet for which of all of those were overlapping. And then on the back end, we manage things like whether a family, whether the eligibility criteria is 50% of the federal poverty guidelines or 213%, so that system navigators and parents don't need to keep track of that. We've got it so that if they enter something or if they, select any of this other information, it'll show them just what they're eligible for based on what they've selected. And so if 5 programs, for example, use homelessness as a criteria, then it's only represented once on this array of household circumstances. The next question, of course, is household income. And we worked with all the different programs and agencies to make sure that we were asking this in a way that would get families as close to eligibility determinations as possible. And so they were okay with a gross annual amount. And once you enter that, you'll see all of the programs that you're eligible for based on what you've entered. And for those of the programs that are above the line, we're able to see that those are on the application. This next screen is for those that are below the line. They're not yet on the common application, but we're working with them for them to be included. And families are still able to navigate to them to learn more and to go to their, some of them might have online applications separate from First Five, or they may have different enrollment processes. And so they're still able to find that information in one simple place. And because we know that families said that they're very busy and they would like more time, they can have all of this emailed to them so that they don't have to sit here and read through all of it when they've got 5 minutes, maybe, while they've got a toddler sticking a toe underneath a door, So this is one way for families to be able to look at it now or receive it and look at it later at their leisure. Also, we know and have heard that a number of system providers and direct service providers have been using this with families when they make home visits, for example. And so this red start over button is really important because then it clears all their cookies and their cache, and they'll have a blank screen again on the screener, and they can do it again with the next family. You can also complete for an additional child. So if you have multiple children in your household, this preserves your household income information, and all you'll change is your child's date of birth and any additional circumstances that apply to your child, such as if your child has any behavioral concerns or has been suspended or expelled or removed from a childcare setting based on behavior. We also have a way for families to look at providers in their area. So for example, these are 4K options and childcare options in their community based on the information of their address. Now, this is the front page of the common application. So once you've gone through and you've seen what you're eligible for and you think, I'd like to apply for some of these, you can either pretend you're checking out at Belk and apply as a guest, or you can create an account so you can come back later and store documents. If you start as a guest, at any time you decide you want to come back later or save an application, it'll come up with the option to save and create an account. So we start with collecting basic information. These are the fields that are asked on every single application on the First Five Common app. That way you only have to fill it out once here, and it's pre-populated onto all the other applications. And this is where you'll add additional child information and consent to have this higher level of detail sent over to partners who are participating. And so that is also matches federal and state requirements for privacy. So these are the programs that are on the application that this family would be eligible for. And you'll see here First Steps 4K Plus. And so that is at the sort of top of the list for families who would like to receive both First Steps 4K and childcare scholarships. And so with that one application, they'd be considered for both programs. And that would mean that a family would be able to have presumptive eligibility if they were determined eligible for 4K. And then all the other children in the household would also be able to receive childcare scholarships. The child would be able to also receive a childcare scholarship for 4 full day childcare beyond the 4K day. And so we also have childcare scholarships, and that is fully integrated with the Department of Social Services and goes directly into their application system. Also, families can pre-apply for WIC through this, and also for a whole array of programs that are offered at the First Steps local partnerships in each of our 46 counties. So how did we build this? It took a lot of will building for people to accept the vision and then understand sort of what our scope was. So we had to define that we would be working with public programs because that was in our purview of governance. That's what we had some kind of authority or ability to manage. And so that's the governance structure was for it to go through the Early Childhood Advisory Council. And they did vote to adopt this as a project. And since its inception with PDG funding, we've been able to leverage that work and are now funded in part with state dollars for ongoing maintenance. And it has been adopted in legislation as an initiative of the ECAC and one of our legislative duties. We engage stakeholders at all levels. We talked to direct service providers, nonprofits who were system navigators, and we talked directly to families as well as system leaders around how could this create efficiencies? How could this assist all of us as another way for families to receive information that was sort of streamlined and co-owned as a state entity? And then we have plans to continually engage stakeholders to make sure that we maintain it and that we have and sort of an ongoing understanding of how this best meets families' needs and we can continually improve. We identified funding needs and sources, not just for PDG and the initial period, but looking at the sustainability of the project and what would First Five need over its lifetime, and recognizing that at some point it will enter maintenance phase and would need ongoing dollars to be supported. And then we had to build it. And building it is where we faced a lot of the challenges, but also a lot of the opportunities. And so we had a really accelerated timeline. And I know that many of you will also recognize that there are challenges that are related to procurement guidelines and making sure that we follow all of the procurement guidelines as state government entities and maintain full responsibility around that. And so that did take quite a lot of time to work through to make sure that we were able to begin the project. And so as far as the actual build of the website and eligibility screener, we did that from April of 2021 through December of 2021, and then had a soft launch, extended pilot, and publicly launched the portal in February of 2022. And then we began work on the application and launched that May 1st of this year. And so that was a really accelerated timeline to onboard 10 agencies and collect information for 60 programs. So that was a lot of meetings. And I'm sure everybody here is familiar with having lots of meetings, but that was so we could collect and make sure that we had all the right information, that it was tested and vetted by all of the programs so that they were comfortable with the wording we used to describe them, and that they tested the screener themselves to make sure that it worked and got them the information they needed. And then there was also a lot of training that we had to do to make sure that they understood how to access their accounts, not only for the leads from the eligibility screener, but also for accessing families who applied, and making sure that we were able to have some streamlined processes there. And so, we really had to think carefully about how to make sure we were able to contain all of this information and satisfy everyone's requests and be very thoughtful about that. And then we also were really thoughtful around promotion of First Five and sharing First Five, because if you build a resource and you've spent a lot of time making sure it's accessible and translated and comfortable to be there and really focus on having a great user experience, we want people to know about it, to be able to access it as a resource so that they then can access other programs and services. And so we also spent a lot of time and effort on promotions. And so we did things like bus stops and washaterias and grocery stores and gas stations, and targeting some of those by zip codes. So for example, the laundromats were all in looked at census zip codes for high poverty areas. And then so we had, in that way we targeted special populations through navigators, through our communications outreach, and then also just had sort of a targeted universalism approach through making sure that all families were able to find out about resources through broad, sort of more broadcast type communications. Some of the things we're doing for ongoing communications to help families access First Five and learn about programs are newborn supply kits, and then also working through creating a training for direct service providers that will go live at the end of this month. And so we know that First Five is working. In our first year, we've had since we launched in February of 22, we've had over 130,000 unique visitors, and about 10% of all of them are actually fully completing the screener, and almost 80% of those are eligible for at least one program or service. And I know many of you are thinking, well, 10% is not a high number of people to complete the screener, but it's actually a huge conversion rate, so that families who are coming there then complete an action on a website. And so it is unique in that way for families to have that high of a number of actually completing something when you go look at something. So I'll turn it over to questions now. I know I've been talking for a while.
And quickly, Rachel, there was one question in the chat that I'll throw out while others are getting ready to hop off mute and ask a question. You had mentioned that 90% of your people are accessing the website on their mobile device. The question was, how did you gather the 90% data? Where did you get the statistic from? Was it from looking across traffic across platforms, or was it survey?
What was that last word you said?
Or was it a survey? How did you gather the data?
We know the 90% based on Google Analytics for the website. And so we are looking at those types of metrics for conversion rates and click rates and top search terms and things like that to make sure that we're collecting information about use so that we can develop it as a product. And then we're working on a larger evaluation plan with the Early Childhood Advisory Council Evaluation Coordinator.
Okay. Other questions, feel free to come off mute and ask any questions.
What was an unexpected challenge?
That's an excellent question.
That is an excellent question. I think probably an unexpected challenge.
Or something that surprised you, that you were like, this seems like it's easy. Why is this an issue?
I think one of the things probably was, looking at eligibility criteria across that many programs and making sure that we got it all right. So that really, like when I say it was a clunky Excel sheet, it was really a lot of columns, like this one has this and this one has this, and then how do we sort of map that out so that the screener can look at all of those things on the back end without having families need to enter a lot of different types of information. So streamlining that and making that simple was actually very complicated. And then also how we worded the household circumstances. You wouldn't have thought that it would take that much time to think about how to word that best so that it makes sense, that everyone agrees on it, that families aren't offended, and that families understand what it means in common language, and then making sure that it's at a third grade reading level. So that took a lot of time too, where I was thinking that'd be a really quick part of it.
And you mentioned languages. How many languages is the site able to be or is translated for?
We're using Google Translate. So there is a Spanish button, since that's the highest second language in our state. But once you click that button, you're able to select any of the languages on Google Translate.
Okay, wonderful. I have a bunch of questions, but I'll pause a little bit and look for some unmuting. Hannah.
So, Rachel, you just actually, the thing that you said was the hardest was what I thought would be one of the hardest. I mean, one of the things that we always struggle with is all the programs have different deductions, and it's a real challenge when you think about, I mean, we actually have eligibility for SNAP, Medicaid, and SNAP all together, but then all of our other programs are not together in terms of applications. And one of the biggest things we run into is that trying to figure out how you deal with so many different deductions. And it sounds like with the screener, you really did use an Excel spreadsheet. Is that right? I mean, what was the mechanism that you guys used to pull the screener together?
Um, sorry, I'm trying to like encapsulate all of the questions. So we pulled that document together, and that contained all of the information we got through discovery and that we received from each of those programs. So all of that information was individually vetted by each program and agreed on that they were all right with the way where we were collecting this information on the screener, and that it yielded the right results that got the majority of families as close to eligibility determination as possible, recognizing that there will always be special circumstances, and that some families will always need more assistance. And so that's why they're able to contact constituent services or know what their next steps are for who to contact if they have any additional questions. And then also, if for some reason they receive a message that they're not eligible for a program or service, then they're able to reach out to that program directly if they're still interested or think they could benefit.
And
does it explain why someone, explain why someone was denied over income or other reasons why they might not be eligible?
Not at this time.
Okay.
I'm just envisioning the Excel spreadsheet and being like, wow. The question, elected officials must be very pleased with this question mark.
Well, I know that there has been a lot of information sharing with them about the portals and, the efforts to work together and coordinate among all of our agencies. So, and I think that's probably, evidenced by the fact that this was, voted into legislative duty of the Early Childhood Advisory Council this last session.
It feels like there was some political will building that went on as well, and maybe even a little success stories. So you were able to tell the story of how great this is going to be and what the initial feedback was. And those are two really important sustainability pieces too. Can you tell the story and use that to help build the public will? So those are important pieces. I have a super boring question, but you had referenced, and it made me think of it when you referenced procurement. Is this a custom built platform, or is this an off-the-shelf platform that was customized?
So it was sort of built to our specifications based on what our needs were. And so, it meets all of our state requirements, and it's all owned by South Carolina. So it is a resource that's owned by us. We own the information. And then of course it's a few pieces of software that are used to, manage the content and that type of thing.
Can you give me an idea of the team that pulled it off? So you had to have some people that speak tech speak, that know that technology. Like, what was that really core team that really was the implementation team? What did that look like? And like, what was the size? What were the people that you pulled together?
So our core build team was about 6 people.
Looking long nights with lots of coffee.
No, those were so we met bi-weekly, and then would do a lot of work in between, sort of like a sprint. So this was a sort of a hybrid project management approach, and so we met every 2 weeks and then would do our work in between. And we had our executive director, Georgia Miarton, who worked with all of the ECAC partners and agency leaders. Then we had Karen Oliver, who I believe is here today, who is the project or the program manager for the Early Childhood Advisory Council. Beth Moore, our director of communications, myself, the project manager, the account manager at our vendor, and then the lead developer and owner of our vendor, who built First Five technically. And then on the vendor side, there were of course graphic designers and another coder who worked on coding with our lead developer. But
you did have a vendor, so if somebody was interested, like, do you have a scope of work you would be able to share if somebody really wanted to get into sort of like the technicalities?
Absolutely. And we also were fortunate to receive funding from Pritzker Children's Initiative to provide support to other states about building portals. We developed a toolkit that launched just a few weeks ago. And so I'll drop the link for that if anyone would like that information. And I see that Karen raised her hand, which I'm excited about.
I wanted to let you know I've already dropped the toolkit in the chat box.
Oh, wonderful. Thank you.
Yes. And it really is, it has the scope of work. And I guess what I would like to underscore a couple of things. First of all, this really wouldn't have been done without a staff team here at First Steps, namely Rachel Hatton Moore. Because you can outsource the work, but you really need somebody to stay on it internally. And so I wanted to make sure that Rachel got have lots and lots of kudos, because honestly, that spreadsheet wouldn't have happened without her. And I also wanted to reflect back that we are very pleased with our custom build product. And because it does allow us a different level of engagement with the vendor that you might not have with one who has a product that is already built, and then you have to make changes in a ticket system. And then if Georgia were here, she would let us know, and we would also completely agree. You can build it, but without promotion and budgeting for that, you will not have more than 100,000 folks, unique folks, come to your site and know and learn of its value. So you really need to be thoughtful about not only the build, but also the promotion of it, so that it is a valuable and useful tool for the families. That's all.
Some very important pieces, that's all, but also very important pieces. Mary shared she's worked with early childhood integrated data. It is often org-to-org MOA or MOUs or agreements that can be as or more challenging than the technology pieces. Did you have any barriers to the, especially, at least from what I have experienced, and I'm in Michigan, what I have experienced is navigating privacy issues, and that there are, but it's FERPA, but it's HIPAA arguments that start to go on. So I was interested in that kind of both Karen's comments and Mary's comments lead to an interesting question that I had also, which was, did you have barriers, or do you have advice for somebody who is at a stage where they are ready to implement, or they're really having the conversations ready to take next steps? Do you have advice about navigating barriers or advice for them?
Start those MOUs really early in the build process, and be very clear about like your timelines for that, because I will say that was also an unexpected challenge, is that we had delays in legal teams having time to review and make those agreements, and those were individual agreements with each of the 3 participating agencies on the application. And so that process did take quite a bit of time. And then that process has taken quite a bit of time when we when we think about the onboarding the local partners and what that takes. Each of those will need a MOA as well. And then anyone who accesses the application or a lead from their staff also needs a confidentiality agreement, and then has an account that needs to be managed by someone, and make sure that that is updated and maintained. So, those are other considerations. But as far as immediately, if you're thinking about taking this next step immediately, I am excited for you, and go ahead and have a plan for how you plan to engage your stakeholders. and a really firm communications plan, not only for your promotion and outreach, but what your internal communications will be. I think that's been one of the lessons learned too, is like when you're managing a project across this many agencies, it's really important to sort of already have thought through how you'll engage them. And we were also thoughtful about sort of our discovery timeline and who we would talk to when, and letting them know, like, we want to talk to you, but we need to talk to these other 3 people first. So does that answer sort of the spirit of the question?
Yeah. Awesome project, says Mary. I agree. It is an awesome project. We've got about 2 more minutes before these rooms are going to close. I have a bazillion questions. Are there other questions from those in the room that you would like to get out before we take off? And then I will put you on the spot and say, Rachel, can people reach out to you after this webinar if they go back, talk to their teams, and would like to have more information? Any other questions from any of our participants?
We actually have a grant from the Pritzker Children's Initiative to work with other states in providing them some one-on-one TA if folks are interested in learning more and doing more. The toolkit is a great place to get started, but we're happy and able to offer what we've learned as lessons if anybody is interested in doing more with their own eligibility screeners or developing a common application.
Thank you for mentioning that. And I think we received the toolkit, and I think we're going to be sharing that out as well so people can have access to the toolkit. Well, we have 54 seconds. I want to thank you, Rachel, so much for your great presentation. Thank you, Karen. Anna has asked, would you mind posting your email so that they could reach out? And if you've got a time, throw that in the chat, and otherwise we will make sure that when we send out the recording and the follow-up, there you go. Thank you. We'll make sure that that information is included as well.
Thank you,
Thanks
everyone.
a lot. Yeah, thank you. This was great.